Epidural anesthesia. Some women need or want to have more pain relief than relaxation techniques or narcotics offer. While spinal anesthesia is used occasionally, epidurals are the most common form of regional anesthesia. Intrathecal or light epidurals, which use a different combination of medicines, are available in many birth settings. These allow a woman to feel pressure rather than pain and permit some limited movement during labor. Some women who receive light epidurals are even able to walk with extra support from their nurses and birth partner. In a first labor, an epidural works best if administered after active labor is established and the cervix is dilated to 4 or 5 centimeters. This is because the earlier an epidural is given, the more likely it is to slow labor down, which may in turn make other interventions necessary. An anesthesiologist or a nurse anesthetist administers epidurals.
I want you to lean forward as much as you can.
Your support person or nurse can help you curl into the correct position.
Feels like good.
Before and during the procedure, you may find it helpful to use breathing and relaxation techniques.
Your back all nice and clean.
Last one.
First, the lower back is cleaned with an antiseptic wash. Then, a local anesthetic is used to numb a small area of your back.
Now you're going to feel my hands pushing as I told you. All right?
All right, this is usually the worst part, all right?
This is going to feel like a little bee sting because it's the numbing medication. It's kind of like Novocaine.
Then, with your back arched like a rainbow, the doctor will insert a needle about 2 inches into the epidural space surrounding the spinal canal. Next, a thin plastic tube is threaded through the needle. This tube, called a catheter, will deliver the medicine to the nerve fibers that send pain signals to the brain.
Now, all the medications that I give you are going to go through this catheter. The catheter, as you can see, is a really tiny, tiny tube. And through this, I give medications. This thing comes off, and I use a syringe to introduce medications right into your back, okay? Now, the next thing I'm going to do is to take the needle out.
When the needle is removed, the plastic tubing is securely taped along the back to prevent it from moving. Then it is usually taped to the shoulder or chest. This allows easy access for repeated doses or for continuous infusion by electric pump.
You might feel a little cold as I'm injecting that. Do you feel a little bit of cold? Okay, that's perfectly normal.
A small test dose of medication will be given, and when it is clear that the anesthetic is working and you are suffering no adverse effects, you will receive the full dose. From the time of the test dose, it may be 20 minutes before you receive complete relief.
Nothing hurts, no pain. Okay.
When the anesthesia does take effect, you will have little to no feeling from your abdomen to your mid-thighs. Your blood pressure will be taken at least every 15 minutes, and your baby's heart rate will be monitored at all times. You will receive IV fluids to prevent a fall in your blood pressure and to allow easy access to a vein should other drugs like Pitocin be required. Because the nerve surrounding your bladder will be numb, you may need to have a catheter inserted to empty urine. Sometimes urinary catheters can lead to bladder infections postpartum. Labor may slow down in response to the anesthesia, and as a result, in some cases, Pitocin will be added to the IV fluid to stimulate labor once again.
All right. Good woman. Yeah. There you go.
Some women prefer to let the anesthesia wear off for the pushing stage of labor, which permits better control over the muscles you'll use to birth your baby. If the anesthesia is still in effect when it's time for you to push, your labor partner and nurse can help you hold your legs and give you clear instructions about how and when to bear down. Well managed, an epidural is a tremendous relief to many women, but there are some risks associated with anesthesia. For a small percentage of women, epidural anesthesia is not effective, or the relief is patchy, which means the contractions may be felt on one side but not the other. Other potential risks include decreases in maternal blood pressure, a longer labor due to slowing of contractions and to slower fetal rotation and descent, maternal fever, which makes it likely the baby will need to go to the newborn nursery to be evaluated for infection after birth. Epidurals also present higher risks for a forceps delivery, vacuum extraction, and cesarean birth. Other possible side effects for women during the postpartum period include severe headache and persistent backache. Very rarely, epidurals may lead to long-term complications. If you discuss all the risks and benefits of epidurals with your care providers, you can feel confident the choice you make is the right one for you.